Comedian, author, and commentator D.L. Hughley has entertained audiences across multiple shows, including The D.L. Hughley Show and the Comedy Central special D.L. Hughley, The Endangered List, which was honored with a prestigious George Foster Peabody Award. He's also the author of multiple bestsellers, and his latest, Surrender White People, Our Unconditional Terms for Peace, came out last summer. Like many of our guests today, D.L. Hughley contracted COVID in 2020 as well. D.L. Hughley, welcome to Healthline.
Hey, now, good morning. How are you?
I'm doing great. It's so great to have you here.
Well, it's great
so
to be
I wanted to talk to you a little bit about your COVID experience because, like a lot of people, you were asymptomatic before you actually tested positive for COVID, and you were tested because of this very frightening incident in which you collapsed on stage.
Well, I wasn't frightened. I was unconscious. I wasn't scared. I was unconscious.
Yeah. Good clarification.
I was in Nashville. I was performing, and then I wake up in the hospital, and they ran all kind of tests, and one of the tests, of course, that they ran was the COVID test, and they found out I was positive, and which any virus, in conjunction with my schedule and not resting and a whole series of events caused me to pass out, and otherwise I might not have known it. But I subsequently infected the entire office, that my radio show, my son included, and even the venue, the proprietor of the venue. So it was very it was turbulent, to say the least.
Yeah, I believe it. And what was the aftermath of that? Like, what was your recovery, and how are you feeling today?
Well, I feel a lot better. Well, I couldn't actually never get COVID in another city, and everybody knows you have it because you can't get on a plane, hotel, try to kick me out. So I get home, and then because it was so public, when I'd gotten home to Los Angeles, I passed out again, and I had to go to the hospital. If it weren't for a lot of my Anthony Andersons and Cedric the Entertainer, George Lopez and Don Cheadle and Chris Spencer, we have this chat, and they were able to get me to UCLA. So, and to find out that I was severely dehydrated, which a virus obviously tends to do. And I would say I started feeling better probably 2 months ago, where in terms of I would just be fatigued and dizzy, and then it would be my blood pressure would just drop all of a sudden. So it was I guess I would be what they would term a long hauler. So it's been an interesting journey.
Well, I'm glad that you started feeling better.
Me too.
And I know that on your radio show and on your various social media handles and in your comedy, you often, kind of talk about sort of hot topic issues of the day and create those discussions with your listeners or your followers. And obviously right now, vaccinations are a huge topic of conversation. And I'm curious about what has that been like on your platforms, and what are you hearing from your audiences, your followers on social, and what's the message that you're sharing with them?
Well, ultimately, there's a lot of mistrust, I think that this disease demonstrated all the things that they just exacerbated all the things that naturally exist, from healthcare, from the conditions of our medical treatments in our communities, from lack of resources, lack of caring, lack of empathy. It was a perfect storm, lack of information. So almost invariably anything that could go wrong did, and it just decimated our communities. And now is just a lot of mistrust. I remember there is a place I grew up on 135th in Avalon. This clinic is on 42nd in Avalon. It's giving out vaccines. So we contribute to it and bring lunch and supplies and water and food. And so we go there, and it's right in the middle of the hood, and you couldn't get more Black and brown. And because there's obviously a need. Every person I saw online, out of the hundreds of people, were all young white people. And so even the resources that are available to us, we're not accessing. And I know I was speaking to someone from the city, and they were saying that only 3% of our population had been vaccinated, which is troublesome because if a new variant hits, it's obviously going to can cycle out and start these same things over again. But I think that there's a tremendous amount of mistrust that have been born of all the things that have been kind of festering in this country for a long time. And it just hit at one time under the guise of this pandemic, which exposed just so many inequities in our system. And I'm mostly, obviously, I know what it's like to have COVID. I have taken the first vaccine. I made sure that I took my children and the people that worked around me to get it. We stood in line after a certain point. They have extras, and so you can stand in line and access that, and that's what we did. And I'm just gonna do what I've always done and try to live out loud and see as an example and show people what it is I believe and what it is I do, and if hopefully I can reach some people. But it is really a desperate situation because I see a lot of the people who are getting vaccinated and they're not us, and that is going to be problematic if we don't access this information. But how do you get people to trust a system that never has proven trustworthy?
Right, exactly. And similar to something we talked about earlier is that, it is, the onus is on those organizations, those institutions, those public health organizations to build that trust and to do the work, to walk the talk, really. And you mentioned something about sort of, your approach to this and living out loud. And I asked Leslie Stahl this a little bit earlier, but more in terms of the role of media and journalists. But what are your thoughts on the role of celebrities or other public figures like yourself?
Well, I think our role is to not be a spreader of misinformation. It's interesting because in our community, if you have all the credentials, if you're an infectious disease doctor, that doesn't resonate as much as if you wear a collar and speak on the internet. So we're suffering from as much misinformation. My cousin said, I heard this. So I've tried to be very deliberate in the things that I say, but ultimately it is this. I don't know very many people who have died as a result of taking the vaccine. I know scores of people who have died as a result of COVID. And so it's at a time when we need, and I think the media in that they have been complicit in that at a certain point, truth became expendable. We killed truth, and then we needed it at a time when we needed it, it wasn't available. We would, more people, you could get on the internet and spout truth, or you could get on a television and say these outrageous things. And then all of a sudden, when people get and to Leslie's point, people they only go to places that edify their perspective. I don't care if you're a vegetarian or you're a vegan or you're a meat eater, you're going to need other nutrients to kind of nourish and have a well-balanced approach. And I think you need that mentally too. I think we don't challenge ourselves. We don't, investigate other people's positions. And now we are in these echo chambers, and there is clearly a group of people who have a lack of trust for the medical, the medical arena in general, and the government, and all the systems that you kind of need to make this, to kind of have this cohesiveness we don't have. And it's all the things that have happened here coming on the roost.
Yeah, definitely. And it's going to take a lot of work to rebuild that trust and get back to that place where facts do matter and where we can all agree upon the science, and we can all agree upon, what's right.
Right.
And so,
because science has been used, and I don't want to, science has been used to do any number of things. Like there's a man who has a statue in the middle of New York who performed gynecological surgeries on enslaved women, and he is the father of modern gynecology. So I think science has been used to do the Tuskegee span, any number of things. So really, at a time when you need science, when now you're supposed to be able to lean on science, that relationship is fraught, and it's just. For me, it is. I understand, and I try to educate myself to the extent that I can. But I know how important it is for my people and people who come from my communities. I know how desperate it is, and I know how urgent it is, because if any one of these new variants it becomes resistant to the current vaccines, then we start. Something was very interesting. The American life expectancy dropped a year in 6 months. Yeah. 1 year. Black people's life expectancy dropped 3 years. So if this happens again, we don't have lives and years like that to waste. We already live longer, less time than anybody else. But this thing is literally taking years off our lives collectively. And I just, it's hard to say that in a joke or a book that people get, but it's just that desperate to me.
Yeah, it is a desperate situation. And I think you bring up a really good point that is a great reminder both for, health organizations and Healthline as a health publisher, that we do need to call out those parts of our history and our present that are wrong, and that are those objective measures that are built on falsehoods and that disproportionately impact negatively Black and Brown people, for sure.
Right.
And so, thinking on the months that have passed since your infection, are there any kind of lingering lessons that really stand out for you that you would like to share with our audience today?
I thought, I'm a pretty healthy dude. I work out, I drink a lot of water, I exercise, I try to eat pretty good, and I was pretty certain that it wouldn't happen to me, and it did. And when it did, virtually, I didn't have the debilitating effects that some people did, but I had the long haul effects, the fog, brain fog, the fatigue, the dizziness, I felt outside of myself for so long. I wonder if I would ever get to see me again. And so even the mental, the thing that you need it's difficult, because the things that I would always have as a level of catharsis is being on stage and being around people and performing. That's taken away. Other people, it might be a church, that's taken away from me. Other people's a school. So, and I think one of the things that in our community is really important is physical touch. Well, you're denied that too. I mean, the first time my father-in-law, who's very close to my children, got to hug his granddaughter was a week ago, and they hadn't hugged in a year. And it was very touching to watch that happen. So we're almost disconnected from everything. And I think one of the lingering effects of that is a sense of loss, and not just of lives, but out of connection to a community, a connection even to yourself. So it's going to be sorting through and kind of getting started again is almost as fraught with kind of trepidation as the situation is right now, because it's at least this. I mean, it's like wearing tight shoes, so you feel good when you take them off. So.
Well, and now we're coming up on we're on the 1-year anniversary of the pandemic, and a lot of people have been sharing across social sort of their last normal thing, the last normal thing that happened before this, everything kind of went sideways. What was your last normal thing, and what are you most looking forward to once we do get to the other side of this?
The last gig I had was in San Antonio, Texas. And I remember my agent calling and saying they might have to reduce the capacity of the room. And I was like, what? And he said, oh, yeah, but I think, and they were talking about, they were going to it's a week or two, you might lose some gigs or whatever. And then I got home and, I would see it on the news. I get a call from a friend of mine, and I'm at the golf course, and he goes, you got to be home by 5 o'clock because Gavin Newsom shut down the state of California. I'm like, what the hell are you talking about? You can't shut down California with a fifth license. And you better believe we're supposed to have our ass home. I could not fathom that was possible. Like, I couldn't believe it. Like my wife, of course, she was, I read about this and I heard about it and I'm getting alerts. I'm like, whatever. It actually happened. And it was like, you couldn't, like, for a while here, they closed the beaches, they closed the running trails, they closed the golf course, everything. So you just had to be home. And it was, I've always been very cynical, but I just never, that scope of reaction never entered my mind. And it was crazy. It was crazy. The one good thing about you get weed delivered, that was great. I think that's
fun fact, that happened on my birthday last year. And
was your birthday?
As a result, no one wished me a happy birthday.
Was your birthday?
On the 16th. That was when we got the note from Newsom.
My birthday's March 6th. Happy birthday coming up.
Oh, so, hey, Pisces.
There you go.
Now I'm watching two friends here talk about their birthdays. Deal. Thank you for joining us. It's
very much.
here. as you were talking about the last gig in San Antonio, when are we going to see you live again?
Well, I'm gigging now because, unfortunately, when it's calf capacity, I say if you want to work, you got to go to a state where the governor doesn't give a damn about his people. Like if you want to work, there are a few places you can work. But I'm looking forward to being able to work in front of full crowds, because even when you work, there's a disconnection. Like there's glass everywhere. Like literally, it's so much plexiglass. I don't know whether to order a tank of gas or tell a joke, but I miss the connection of, and even when they are there, there's such fear. They're aware of what's going on because it's disinfected. I'm looking forward to people laughing out loud without wondering if the person that's next to them is in danger of their life.
Before you go, DL, I just want to invite you to stay on the broadcast here if you have time, because I know you're going to enjoy the conversation that we'll have upcoming with Han Lee, our Chief Medical Officer.
I gotta get high. I can't stay here. I have to get high and get ready for my show. I'm sorry.
You'll get high watching Paula Smith and Philip Hamilton.
Oh, enough of you doctors. I need Dr. Green. That's where I'm going.
Well, DL Hughley, thank you again so much for being here today and sharing your insights and your thoughts. And stay healthy. And we look forward to sharing more laughs with you in 2021.
Likewise, and happy upcoming birthday.
Thank you.